SI joint pain is miserable. This is pain that happens low in your lower back, and it can radiate up into your lower back, and then it can also transmit down your leg in the form of sciatica as well. While it can be awful, the right techniques and the right exercises can help to fix it now and prevent that pain from coming back in the future, and that's exactly what I want to share with you in this video today. My name is Dr. Jared. Did you know that your pelvis is actually 3 bones? You have 2 iliums, there's one on the left and there's one on the right, and a sacrum right here in the middle. Where they come together is your sacroiliac joint or your SI joint. Now we call it a joint because it's where 2 bones come together, but in reality, there should be no motion there. It should be a very stable structure. It actually serves as a shock absorber between your legs and your trunk, and it also serves as a platform that your vertebrae is built on top of. Again, the idea is that it should be very stable. When it gets irritated, or if it gets out of place with repeated activities, with trauma, it can be a source of pain. However, the most common cause of this that I treat is in pregnant and recently postpartum women. Your body releases a hormone that increases laxity in your ligaments in preparation for childbirth, and that shift can cause pain in this area. And so in this video, I wanted to show you some simple, effective exercises to put your SI joint back into a normal alignment. That will eliminate pain now, but then I've also got some exercises that you can do to strengthen the muscles in this area to increase stability and keep that pain from coming back. I hope you get incredible benefit from this. Let's jump in. The first thing that we need to do is get your SI joint back into a normal pain-free alignment. I've got 3 techniques to show you to help us to do that. My goal with these is that you identify 1 or 2 or even all 3 that helps your pelvis to feel the best, and then you can continue to do that as you continue to work on this issue. So this is what they look like. I want you to go ahead and lie down on your back, and I want to start with the painful side. So if I had pain on my right, I'll demonstrate on my right leg. And what I want to do is bend my right knee up into this position, and then with both of my hands, create a block on the inside part of my knee. Now hold your hands nice and secure while you pull up into your opposite shoulder with your knee. So I'm gonna block with my hands, but then with my hip muscles, I'm gonna try to pull my knee. I'm trying to pull my knee up and over towards my left shoulder. I'm gonna hold that for about 5 to 10 seconds and then relax, and then repeat that about 5 times. If you get done and notice a reduction in your pain, that's an indication that that is a good exercise for you. However, if it increases the pain, that tells me that we're pulling the joint in the wrong direction, and that's probably not the best exercise for you. If you do have pain on both sides, you can even try this on both sides as well. So that's technique number 1. Again, the benchmark, the goal that we're looking for is a reduction in symptoms. Technique number 2, I'm going to show you on the left side now. If that pain were on my left side, I want to, with both of my hands, I'm now going to block the outside of my knee, and then it looks similar, but I'm going to take the knee up and to the left. I'm going to block the outside, and now my pull is up and in this direction right here. So you're going to feel it in slightly different muscles, more in the glutes, more in the hip abductors, but the parameters are the same. You're going to hold that for 5 to 10 seconds and repeat it 5 times and look for a reduction in your pain. Look for a reduction in your symptoms. And if it's on both sides, you might check it out. You might try that technique on both sides as well. Technique number 3 is going to be I call it the scissor technique. You're just going to need a broom, a mop, a dowel. I have a golf club, something that's strong, something that doesn't bend or flex. Now with this, let's say again that the pain was here on my left side. I'm going to start by putting my left leg over the top of this golf club and then grab firmly with my hands on both sides. So it looks just like this. And so now I'm going to bring my right leg up so that it touches the golf club. And now I'm going to scissor with both of my legs. I'm going to push down with my left leg into the golf club, but I'm pulling up with my right knee into the golf club as well. But my hands are nice and firm, so the golf club doesn't go anywhere, so it becomes an isometric contraction in my hips. I'm pushing with my left, I'm pulling with my right. I'm gonna hold that for about 5 to 10 seconds and then repeat that 5 times. Once again, I'm looking for a reduction in your symptoms. If it increases pain, it tells me it's not the correct way. We're not moving it the correct way. And so please keep that in mind. On that one, I even like to encourage people to then go the opposite way. So now I'm gonna put my right leg on top, my left leg is on bottom, and then I'm gonna repeat that technique again. 5 to 10 second holds repeated 5 times. And oftentimes between those 3 techniques, those are great at helping to realign your pelvis, resulting in a significant reduction in your pain. I hope you find that to be the case. Did you try any of those mobilization techniques, and how did they work for you? I'm curious, I would love to hear from you. Leave me a comment below, let me know how you're doing. Once we've mobilized the SI joint into a pain-free position, we want to stabilize it there with the right strengthening exercises. And specifically, we want to target the muscles that cross that SI joint, our glute max, our piriformis, our hip rotators. Those are the ones that are gonna hold it in place and keep it pain-free long-term. And so I've got 5 exercises to show you to do that. I'm gonna show you with this small resistance loop. You do not have to have one of these for any of these exercises, but they definitely make them more effective. If you want to get a pair of your own, go ahead and check out the link in the description. I've got my set linked down there. And so the first thing I want to show you are some bridges. I'm going to put this loop on and I'm going to put it up and around both of my knees. And so for the bridges, great exercise for the glute max. Go ahead and lie down on your back with your knees bent. In this position, I'm going to contract my glutes to lift my hips up towards the ceiling, hold 1, 2, 3, and then slowly return back down. With the band on my knees, I also want to try to separate my knees. So I'm going to pull out into that band while I perform that bridge. So I'm going to contract the glute, lift up and hold 1, 2, 3, and then slowly return right back down. I would perform 15 to 20 reps of these, and then if you can, try to repeat that 3 times. So 3 sets of about 15 to 20 reps is a great way to target those glutes. The next exercise is going to be what we call a clamshell. So now I'm going to lie down on my side. Preferably, I would start with the side that's affected up. So if it was my right SI joint, I've got my right leg up at this point. Both my knees are bent, the soles of my feet are together. I'm going to keep the soles of my feet together as I pull my knees apart. So I'm pulling my knee up towards the ceiling, hold 1, 2, and then slowly return right back down. And that's what that clamshell exercise looks like. I would repeat 15 to 20 times on the right, roll over and do 15 to 20 on the left, and then 3 sets on each side is a good number to shoot for. Next, we're going to fire up the glute med and some of the other hip muscles on the outside, on the lateral side of the hip. Side planks is my favorite exercise to do that. I'm lying here on my left. I'm going to prop up onto my left elbow. I'm going to engage my left obliques and my left hips to pop up into what we'd call a modified side plank. I'm on the outside of my left elbow. I'm on my left elbow. I'm on the outside of my left knee. And I'd hold this position for about 20 to 30 seconds and then try to repeat that 3 times. Now, if the modified side plank is too simple, you can extend your legs and get into this full side plank position. I'm on the outside of my left foot. I'm on my left elbow. My body's nice and straight. Just a great way to engage, again, the obliques, the hip abductors, the glutes. Great exercise to stabilize across all those areas. 20 to 30 second holds repeated 3 times on both sides. Now, my personal favorite exercise is to actually combine the clamshells with the side plank. So this is what that would look like. I'm gonna get into the modified side plank position. So I'm down here on the side of my hip, pop up into the side plank, and then rotate out into the clamshell, close the clamshell, and then drop the side plank back down. So this is a great way. We're getting a ton of stability through the side that's down, but then we're also working hip rotators on the side that's up. And again, these can be enhanced by wrapping that band back around your knees. And so on this, it's a little more aggressive. Typically, I recommend about 10 to 15 reps, repeated 3 times on both sides. My goal when rehabbing any injury is to progress to upright weight-bearing exercises. With this, we're gonna do that with some banded squats. I've got my band again, and I'm gonna put that right around my knees. I'm going to separate my feet a little bit wider than shoulder and hip width, and then I'm going to drop down and perform squats. I want you to go just as low as pain and strength allow, but with the band around your knees, it's going to want to pull your knees in this direction. I want you to fire your hip rotators to keep those knees right over your toes as you drop down into these squats and then return back to upright. Really focus on the glutes. That's the muscle that we want to focus on as we return to that upright position. I usually recommend about 10 to 15 repetitions repeated 3 times. I hope these help your SI joint to feel amazing, and thank you so much for watching.